All right. Are we ready? Are we live streaming?
Yep.
Well, hello, everybody, and thank you so much for being here today. We have called this press conference to announce that our office is co-leading a lawsuit against the Department of Education over its efforts and attempts to institute a new rule that would narrow the federal definition of professional degree and impose restrictions that Congress did not authorize on students' abilities to access federal funding to pay for their education. This new rule would have a devastating impact on Nevada's healthcare community. The rule would unlawfully exclude degree programs that actually qualify under federal law and would reduce access to financial aid for students who are seeking important, much-needed advanced education in order to serve the critical healthcare roles that our state needs. Pardon me. Joining me here today is Dr. Denise Ogletree-McGuinn, who will shed light on how this rule would harm nursing education and Nevada's healthcare force. And to my left is my colleague, Keel Ireland, who is co-leading this lawsuit on behalf of the office as well. But before we go any further, I would like to highlight the damage that this rule would cause to our students' ability to seek education that they need to do the jobs that they are called to do. In 1993, the Student Loan Reform Act was passed. This act established a direct loan program that made loans available to both undergraduate and graduate students. The availability of these loans ensures that talent and dedication, not status, would determine who can seek university degrees. In addition, because direct loans often have a lower interest rate and qualify for loan forgiveness, they actually provide students more freedom to take lower paying jobs in public interest or in academia, allowing for personal freedom in job selection. Because these loans are funded by the government, Nevada's higher education institutions are not at risk of losing tuition funds due to market conditions. This reliable source of funding ensures that eligible students are fully funded for an entire school year, and do not have to worry about the rug being pulled out from up under them as they are trying to study. In July of 2025, Congress passed legislation creating different federal loan limits under government programs for graduate and professional students, and incorporated an existing federal definition of what a professional degree is and put that into law. Now, the Department of Education has unlawfully altered the definition of professional degree by adding new requirements and narrowing eligibility in ways that Congress never authorized. This is a textbook example of overstep of executive power and straight out of the playbook that we've seen from Trump's administration this entire term. Congress approved 3 criteria to consider a degree a professional degree. Number 1, it signifies, quote, completion of the academic requirements for beginning practice in a given profession, unquote. That it, number 2, signifies a level of professional skill beyond that normally required for a bachelor's degree. And third, that it generally requires professional licensure. That's it. Any further restrictions placed on programs to qualify for these loans is an overstep of executive power, and it's a deliberate rejection of congressional intent. The Department of Education has attempted to place further restrictions on programs such as doctorates in physical therapy, physician assistant programs, speech language pathology programs, and programs for advanced practice registered nurses such as Dr. McGuinn. Would we not all agree that the physical therapists who assist our seniors recovering their mobility after surgery are skilled professionals? Or that the speech language pathologists who treat young children who are struggling with speech delay have a professional skill beyond a bachelor's degree? Or that the 1,500 physician assistants who treat patients in urban, rural, and frontier communities in Nevada need a professional licensure? Let's be clear. This rule will punish low-income and middle-class students whose families cannot afford to pay tens of thousands of dollars for professional degrees. This move by the Department of Education is a slap in the face to those Americans who would seek furthering education to help their community, their career, and their families. We do not pull ladders up behind us in this country, and we do not deny our future generations the access that past generations enjoyed. I'm proud to stand along with my colleague attorneys general in other states to fight this unlawful overreach. And I'm proud to stand aside dedicated healthcare professionals like Dr. McGuinn to say that we cannot make it harder for our students to succeed. And with that, I'd like to turn it over to Dr. McGuinn.
Good morning, and thank you, Attorney General Ford, for your leadership and for standing up for Nevada students, healthcare professionals, and communities. Our leaders have a responsibility to do everything they can to protect access to education and healthcare in our state. As stated before, my name is Dr. Denise Ogletree McGuinn, and I am an advanced nurse practitioner, and I serve as the District 3 Vice President for the Nevada Nurses Association and co-founder and Vice President of the Nevada Nurses Association and Foundation. As a nurse and healthcare leader, I have seen firsthand how critical advanced nursing education is to the future of healthcare in Nevada. I'm here today because this issue goes far beyond a federal education rule. It is about Nevada's healthcare workforce and whether people in every corner of our state can access the care they need. At its core, this is about whether we continue moving Nevada forward or place unnecessary obstacles in front of the professionals our communities depend on. The Department of Education's final rule excludes nursing from the definition of a professional degree program. Beginning July 1, 2026, graduate nursing students will face significantly lower borrowing limits than students pursuing other professional health fields such as medicine, dentistry, veterinary medicine, and law. Graduate nursing students will be capped at $20,500 annually and $100,000 over a lifetime, despite pursuing degrees that often cost much more. At the same time, Grad Plus loans, which previously helped students cover the full costs of attendance, will no longer be available for new borrowers. That matters because graduate nursing education is expensive. A Master of Science in Nursing degree can cost between $20,000 and $100,000, while a Doctor of Nursing Practice degree can range from $50,000 to $200,000 depending on a student's educational pathway. For many Nevadans, these changes are not minor. They could determine whether someone can pursue graduate education at all, continue advancing their career, or becoming an advanced practice registered nurse. For some students, the financial burden alone may put these opportunities far out of reach. And that should concern all of us because Nevada already faces healthcare workforce shortages. Our state continues to struggle with provider shortages, and those challenges become even more pronounced beyond our major metropolitan areas. In rural and frontier communities, access to care can already be quite difficult. Patients often travel long distances for appointments, wait weeks or months for care, and face limited healthcare options. That is where nurses, and especially advanced practice registered nurses, play an essential role. APRNs are often on the front lines of healthcare in Nevada. They provide primary care, diagnose and treat illness, manage chronic conditions, prescribe medications, and help ensure healthcare reaches communities that might otherwise go without it. In many parts of Nevada, APRNs are not simply part of the healthcare system, they are the healthcare system. When access to a physician is limited, APRNs, or advanced practice registered nurses, frequently step in to help fill that gap. Across Nevada, particularly in rural and frontier communities, which make up nearly 87% of our state's landmass, APRNs often serve as a patient's primary point of contact for care, and in some communities may be the only healthcare providers available. They help ensure Nevadans can receive timely care close to home, reducing long travel distances, lengthy wait times, and delays in treatment. That is why policies that make it harder for students to pursue advanced nursing education do not just create barriers for future nurses. They create barriers for patients and communities already struggling to access care. Nevada already faces a shortage of APRNs. Recent workforce research found in our state that we need an additional 717 APRNs simply to reach national averages. That is not a small number. It represents a workforce need affecting communities across our entire state. This is why so many of us are concerned that this policy relies on an outdated understanding of nursing and a classification system that no longer reflects today's healthcare realities. Nursing in 2026 is not what nursing was in 1965. Healthcare has transformed dramatically over the last several decades, and nursing has evolved right alongside it. Today's nursing profession is advanced, specialized, research-based, science-driven, and increasingly central to healthcare delivery. Modern nurses lead care teams, conduct research, manage complex patient needs, and help assess challenges ranging from chronic disease management to behavioral health and preventative care. Advanced practice registered nurses complete graduate level education, extensive clinical training, certification requirements, and licensure obligations. Yet under this policy, nursing is being treated differently than other professional disciplines. That simply does not reflect the reality of healthcare in Nevada. Because classifications shape policy, policy shapes opportunity, and opportunity determines whether students can pursue careers our communities rely on. The Nevada Nurses Association raised concerns because we understand the real-world impact these decisions can have. We have seen provider shortages, healthcare gaps, and delayed care affect communities across our state. We know what happens when barriers are placed in front of the very people we want to serve. National nursing leaders have also warned that excluded nursing from the professional degree category sends an alarming message and could ultimately place patient care at risk, particularly in communities where nurses serve as primary healthcare providers. That concern could not be more relevant for Nevada. This issue is bigger than education policy. It is about whether a student in Elko, Ely, Winnemucca, Pahrump, or any community across Nevada can pursue an advanced nursing degree and return home to serve the people who need them most. It is about ensuring patients can access care close to where they live and building a healthcare workforce prepared to meet Nevada's future needs. The Nevada Nurses Association appreciates Attorney General Ford and the coalition for standing up and challenging this policy, because investing in nursing education is not simply an investment in students. It is an investment in public health and in every patient who deserves quality care, regardless of where they live. It is an investment in Nevada's future. Thank you.
Thank you so much, Dr. McGuinn. And thank you again for being here to share your perspective on this. And thank you, Kill Allen, for your diligent hard work on this. And thank you to the coalition of attorneys general who have joined us in pushing back against this yet again unlawful action from this administration. We'll open it up for questions. Do we have any questions from anyone?
Yes, I just want to make clear, why is it important for the community here in Nevada to be on the worker side and not the big corporation?
Well, I think in the first instance, it's important to note the importance of healthcare professionals such as our nurses, as Dr. McGuinn has talked about, and the impact that they have on community health. Not just here in Las Vegas, not just in Reno, but in other parts of our state, like she's indicated, like in Ely and Elko, and rural and frontier areas, and pushing back against an unlawful executive action in this particular instance is of all the more important because we have a shortage of nurses and shortage of healthcare professionals. We should be encouraging individuals to go into this field. It's certainly because Congress has already recognized by definition, essentially, that nurses are indeed professionals and deserve the ability to be able to pursue an education in this regard. So, look, we disagree with the policy in this instance, to be sure, but more than the policy, this is an issue of rule of law. And the Federal Department of Education has no right to undermine what Congress has said about this already, and we're going to continue to push back against those types of unlawful actions. Do you want to offer anything else, Dr. McGlynn?
I think the Attorney General has stated it most clearly. I mean, it's almost a disgrace. People need to be taken care of. People are living longer. We have children who need immunizations. If you notice in our communities, not just here, but all across the United States, there's measles epidemics. So a lot of times those things occur because maybe there's not access to care. Maybe there's not access to having the medical knowledge that parents and families need to know to make sure that their children are immunized. We've got seniors, we have veterans that need quality care. And so that is imperative that nurses remain on the force, in the force of being professionals. So thank you so very much.
Thank you.
Thank
Could
you.
repeat your name?
Dr. Denise Ogletree McGuinn, Advanced Practice Registered Nurse.
Thank you.
Okay, and thanks everybody.